When I was 5 or 6 years old, my grandfather was a hospital pharmacist, and he would take me on rounds to Columbia Presbyterian Hospital. He would introduce me around to the other doctors, the nurses, and even sometimes patients as his grandson, the doctor. It was so exciting for me, and so at that very young age, I decided that I wanted to pursue a career in medicine. That's exactly what I ended up doing. I got the opportunity to volunteer at a hospital in upstate New York, taking care of patients who had metastatic disease or cancer that had spread to the spine. And the frustration that I saw amongst the doctors and the patients was that they really didn't have the ability to help the patients with their pain. I decided that I wanted to look into a specialty of medicine that dealt exactly with that, the spine and the treatment of pain associated with spinal disorders. After I finished my postgraduate medical training at Columbia Presbyterian Hospital, I decided that I wanted to go and dig a little bit deeper. As a result of that, I trained in UCLA in the pain medicine department there, learning not only neurosurgical techniques for treating patients with spinal disorders, and not only anesthesia-related injection techniques for treating patients with spinal disorders, but also the psychological aspects of pain, how behavior affects pain and how pain affects behavior, and how both of these things affect the way people think and how they feel. I'd like to be able to listen to the patient, have them tell me not only what is hurting them, but what their goals are. I want to have people leading enriched, pain-free lives, or lives which are minimally impacted by whatever illness or injuries they have. The vertical integration of the multiple different specialties in my practice allows me to do that, beginning with physiatry all the way up to more complicated spinal interventions for pain management, neurosurgical and orthopedic spine surgical interventions for those rare patients. Probably less than 10% of the patients that we see end up requiring surgery. We can usually help over 90% of them without a surgical procedure, and I'm really proud about that.